here at the Aoki Diabetes Research Institute interviewing patients who have received metabolic activation therapy. There's roughly $72 billion spent yearly on diabetes, and roughly 10% of those patients spend most of that money, and that's spent on the complications. Complications such as diabetic nephropathy, retinopathy, polyneuropathy, neuropathy, gastroparesis, poor circulation, which causes amputations of the leg. People who go blind cost a lot of money to teach them to be able to function as a normal, somewhat normal person. People who end up with kidney disease end up on dialysis. That becomes very expensive. It's been our experience that metabolic activation therapy can actually stabilize these complications and in many cases prevent them. We've treated many patients over many years, roughly 30 years, with this treatment, and it's been our experience that patients are receiving laser treatments for their eyes. After about 2 or 3 months, no longer need laser treatments. Patients with gastroparesis eventually are able to metabolize their food in a much more normal fashion. Patients who require or may require amputation are spared their limbs by doing activation. Patients who have nephropathy, kidney disease, typically if they're spilling protein in their urine or their creatinine clearance is starting to drop, we can at least stabilize it at the point that they come in at. So most patients that come in, some of them with up to and more than 1,000 milligrams of protein, actually drop to normal. So the reason we do this is because, one, it's very helpful to the diabetic patient. It helps them live their lives more normally. We brought in many patients who have been on disability, who some of them bedridden with complications, some of them in the emergency room 4, 5, 6 times a month. And after doing metabolic activation therapy, all those things drop practically to zero. Most people, another complication that I didn't mention is most people who have hypoglycemia unawareness are then able to feel or sense their low blood sugars coming on. And it's really the one true treatment that helps that. It's also the one true treatment that helps gastroparesis. There's very little that can be done for someone suffering from severe gastroparesis. And we are able to put people back on their feet, stop their nausea, vomiting, and make them more productive citizens. I say all this because if we're spending $72 billion a year on diabetes and a considerable amount of that money is spent on complications, then the advent of metabolic activation therapy could actually save billions of dollars. Patients come in here, metabolic activation therapy requires 5.5 hours a week, so they come back every week. I've had very few patients that came in, started, and then decided they wanted to quit. They all typically stay because they feel that this therapy has changed their lives and made life more manageable for them. So as you're looking at this, take serious consideration as to what is possible for the diabetic with complications. It is possible to reverse all of the complications with one treatment. That's metabolic activation therapy. And seeing is believing. As they say, the proof is in the pudding. We've been seeing this happen for almost 30 years, and it really does work. And I thank you for your time and attention to this video.